Doctors Gary Hopkins and Dr. Duane McBride have been working in the field of addictions for quite a long time. They are passionate about what they do as well. Dr. McBride is the chair of sociology at Andrews University. He's also the director of the Institute for the Prevention of Addictions, the IPA. He's keenly involved in research, in teaching, and he also has a very, very strong passion for coming to meetings like this, working with the church. And then he has a very able associate director of the Institute for Prevention of Addictions, Dr. Gary Hopkins. You've heard him speak in the plenary sessions. You may have been at his workshop on youth and rebellion. He's an MD, a medical doctor, has his doctorate in public health as well. And he has had a passion over, is it 15 years now? But I remember when I came to the ICPA work in 2001, I met this, in fact, I met him in 2000. He's a fellow who would sit in the back of the talks and fall asleep and snore.
That's true.
But you need to be gentle with him today because he's really not feeling well. He's got quite a bad chest cold. But Gary has persistently and energetically worked on the issue of relationships, resilience, and the protection of young people against at-risk behaviors. He's also an assistant director of health ministries at the General Conference, and we're very privileged to have him work in our team. And so, without taking too much more of their time, they're going to talk about family meals and addiction prevention and resilience. Thank you very much.
I don't know if any of you were in the workshop that Gary and I did Tuesday? Yeah, I think it was Tuesday or Wednesday, one of those days. And we talked about many aspects of preventing addiction in various programs. And we conduct a wide variety of research at the IPA. And as Kiti said, working with her at times all over the world. But there's kind of an area we didn't really cover that much in our previous workshop that we've really gotten into and presented actually a number of scientific and professional conferences. Oh, a bit slower, right. I'm from Chicago in the United States, which is the second city. If I was from New York, it'd be impossible to translate me. That's the first city, so I'll slow down. But we've done a lot of work in the last year looking at family meals and what that might mean. There's a university, Columbia University in New York City, that has been looking at drugs and family meals for a number of years, and about over the last 7 or 8 years. And surprisingly, they began to find a positive correlation between the number, the frequency of family meals and drug use. And so Dr. Hopkins got a brilliant idea of why don't we see what else this relates to? Well, Gary, what did you start doing? What did you start collecting when you got into this area?
Well, what happened? Well, first of all, we didn't have the money to do our own research. So I had to find data that's available for the general population. And our Centers for Disease Control, which is our big prevention organization funded by the government, has surveillance questionnaires that they use in most of the states, most of the 50 states. And if you work really hard, you can get those sets of data. And after, I don't know, several months of working on that, I guess, I came up with data from 36 states.
That asked the question about family dinners.
Yeah, and I think 10 of them asked the question about family dinners. The question is, how many meals how many times a week do you eat a family dinner together? Once, twice, 3 times, 4 times, 5 times, more than 5 times. Then there's other questions in the questionnaire that say, do you smoke, do you drink, do you use cocaine, do you use alcohol? How much, have you had sex, or have you had sex in the last month? And what we found, first of all, what I found out when I searched the literature is that there's lots of relationships between positive health behaviors and family meals. And then we're going to give you some data today that's brand new, that nobody's ever seen, And
For the first time.
for the first time, and it's never been published, but it will be.
And for $100 each, you can have a copy. No, just kidding. You can have a copy.
All right, so let's go back to this. Go ahead.
Right here? Well, as Gary said, sometimes you worry a little bit about, you find some variable that relates to a whole bunch of things that looks too magical and looks like too good. But as I said, Gary is able to get raw data from the Centers for Disease Control for a number of states that no one had ever analyzed. And he's really played with it, or both of us have played with it.
Sure we have.
We've had a team at Andrews University that's playing with data. We're kind of, men never grow up, so it has to be play, so we play with data. And we played with data to look at what family meals may relate to in healthy and health risk behavior. And there's just a whole lot of things that it relates to that we're
Positive
beginning to present and publish. Well, one of the first things you found when you looked at was obesity. I mean, I would think if you have family meals, aren't you heavier?
Well, actually, there's literature that says the more people that eat a meal together, the more that you're likely to eat, up to 6. But the literature on family meals says there's less obesity when you eat meals together,
Wow.
at least 3 times a week.
Yeah, and
Less
this is a
obesity.
good point. The kind of break point we found for effect was 3 or 4 meals a week.
Yeah. Kids today in America have about a 50% chance of being overweight. 50% chance. That means half of our kids are overweight. Are you seeing that here?
Yeah. Is it
Getting there?
Getting there? I don't know how European, obesity in the United States is one of our major public health problems.
How big is a soft drink at McDonald's?
How many ounces? Or, I'm sorry, liters here.
I don't know.
Oh.
At McDonald's in Australia, they're this big. In America, they're this big. They are. They're huge.
Well,
They're
I
monsters.
stopped by, there's a gas station on the way into the office. They specialize in 64-ounce Coca-Cola.
That's almost 2 liters.
64 ounces.
Almost 2 liters. And that's sugar. So anyway, the kids born in America have about a 50% chance of being overweight today, or in their lifetime. And the data from the Centers for Disease Control
Yeah.
documents that during the 76 to 86 time, 6.5% of 6 to 11-year-olds were obese. And just recently, between 2007 and 2008, that number is 20%. Now we're seeing these kids get diabetes at a younger age, adult onset diabetes. We're seeing them have heart attacks at an earlier age. We're seeing with health effects, high blood pressure at an earlier age. All related to, or I guess mostly are all related to this. Peter's a cardiologist, he can tell you more about it. Related to obesity, no?
Food can be kind of an addiction. And, we often get pleasure chemicals. We get endorphin dumps, serotonin from the food we eat. Sugar is a high. Fat really is a comfort food. And so the family meals really can help address obesity. Well, how does that work?
Better. Okay, the family meal setting has the potential, I'm just going to read this to you, substantially impact the dietary intake of children and may provide an important avenue for obesity prevention. We're having a hard time, and Dr. Kiti can tell you because she's worked on it for a long time, hard time helping kids who are overweight to be not overweight. It's very difficult. Nothing easy about it. Teaching them about bad foods isn't the answer. Teaching them about bad foods is a fine thing. That doesn't make them lose weight.
Do you think there's ignorance, obesity in the United States? Do you think Americans are ignorant about what causes obesity? No, they're not. In fact, in order to graduate from high school in most states in the United States, you have to pass a health knowledge test. So you have to know what causes disease, what causes obesity, and you can't graduate without it. So every high school graduate in the United States knows what causes obesity. Yet our obesity rates are like this. I chair a health department a county health department around Andrews, and a third of the young adults in the poorest community in my county are morbidly obese. 30% are morbidly obese.
That's 100% overweight.
Right. So obesity truly is one of our major public health problem in the United States right now. Well, all right, family meals, when a family eats together, there's actually some control of calorie intake. Who cooks the meal kind of controls the amount of food available. So you can control the amount of food in a family meal.
Yeah.
If someone's overindulging, it can be noted, and what you prepare is what's eaten. So if you prepare your meal as opposed to going to fast foods, does anyone from an area here in which the menu gives the calories? Any restaurants in all right, so where's that, Dubai or California? Yeah, I didn't think Dubai. Well, in Maryland, I got my master's degree from the University of Maryland. And there is a place there called Farrell's that had great ice cream.
Very nice.
And I used to go there, my wife and I. Well, I was there a few months ago and went to Farrell's with a colleague, and they started printing on the menu the calories. Okay, a banana split of 3 scoops with ice cream, bananas, nuts, and chocolate syrup was 4,000 calories.
Whoa.
Okay, well, I gave that up. But, you know, if you go for fast food, a McDonald's, and I see you have KFC. I think I saw a KFC near Kentucky. They call it KFC. It's Kentucky Fried Chicken. Okay, you don't want to know how much fat is in a Kentucky Fried Chicken meal, right? And so fast food is enormously costly to our society. Family meals, by and large, less fat, less salt, better ingredients, less consumed. But what are the problems with family meals? Why don't we have them? Why is it declining?
Well, opportunities for families to have meals together has been negatively affected by the change in our society, and the data suggests that the frequency of family meals has been declining. In a study of kids at risk for academic failure, all of these students were enrolled in alternative schools. Alternative schools means the kids were having trouble in school. So they were kids with some kind of problem, learning behavior possibly, or could have been a behavior that was dangerous like drugs or something. Students who reported never eating family meals were more likely to be overweight, to eat fewer vegetables, less breakfast, and to be more depressed. They just weren't having family meals. What do you think another problem with family meals is? Television during meals? How about bring fast food home to the house and not even have a family meal? There's other issues involved here
KFC
too.
is there a lot of fresh fruit in the KFC meals here? No, it's satirical. No, there's not.
There's clearly much scientific data available that demonstrates and reports that family meals are associated with
Healthy
healthy meals
fruits and vegetables.
and therefore less obesity. It's associated with more fruits and more vegetables.
How many fresh fruits and vegetables are you supposed to have every day? Oh, yeah, you guys should know. Guess what?
How many servings?
Yeah, 5. Yeah, guess what percent of Americans have that many? Less than a third. We do not. In fact, in Berrien County, Andrews University, where I live, we have to take the Adventists out of our data, or our county looks too good. So there's a zip code where most Adventists live. We have to take it out. When we take the Adventists out of our local data, actually 20% of the population gets sufficient fruits and vegetables. If we add the Adventists in, we look too good. So we've convinced the federal government to not count Adventists. So because that way we get more money to fruits and vegetables to promote that in our county. When you look at our county with the Adventists, it looks like you guys don't need anything. So yeah, family meals really relate to, again, less fat, less salt, and more fruits and vegetables.
Now, figure this one out. A program called EAT explored the association between the frequency of family meals and psychosocial well-being of boys and girls. What the project study data showed is the frequency of family meals was associated with higher academic performance. So you turn the television off, you eat a meal together at least 3 times a week, and your kids do better in school. Interesting, isn't it? Kids do better. Are you surprised by that? No, actually, when you look at the stuff, it's not very surprising. A Reader's Digest survey of more than 2,000 high school seniors compared academic achievement with family characteristics. Eating meals with the family was a stronger predictor of academic success than whether they lived with one or both parents. Eating together, pretty simple stuff, don't you think? Pretty simple stuff. Research by the National Center on Addiction, and Duane was talking about this earlier at Columbia University, found a striking relationship between the frequency of family meals and grades. In 2003, 20% of the teens who got A's, that's the best grades you can get in America, ate with the families 5 or more times per week compared to only 12% of those who ate with their families 2 or less times per week. So to get all good grades, eating together with the family matters. So when someone comes by and says, why do you guys always eat together? And you say, we're trying to help the kids do better in school. Interesting, huh? Well, go ahead. You want to do this one?
Well, yeah, you know, a lot of other risky behaviors seem to be related to, you know, not having family meals together. Over 50% of teens who do not eat dinner with their parents have sex by the age of 15 or 16. The rate decreased to 32% when there were family meals in the home. You know, you cut sexual activity. So when you're having meals with your children and someone asks, what are you doing? All right, we've already said we're helping them get better grades. By eating together, you can also say we're helping them not to engage in early sexual activity.
Yeah.
You know, who would have thought? But these are consistent relationships we're seeing in
And
the
they're very
Centers for
consistent.
Disease Control.
And in the data that we run, we see the same stuff. This isn't a fluke. Teens who have meals with their families are less likely to have suicidal thoughts, suicidal attempts, and less likely to ever be suspended from school. So now we know that they're doing better in school, they're doing better at school, and they're at less risk for sexual behaviors, they're at less risk for obesity. Excellent research reported that family meals are associated with less substance use. Now add that to the list of positive things. One such study reported that the frequency of family meals predicted less substance use along with less stealing and engaging in gang membership.
You know, gangs in many parts of the world are a major problem. Certainly in the United States and certainly much of Europe and Asia, gang membership. When the family isn't bonding at a meal, the gangs become a more powerful attraction. So family meals are good gang prevention and they're good substance abuse prevention. So when you're having a family meal, you're improving grades, reducing sexual behavior risks, preventing gang membership, and preventing suicidal thoughts.
Go ahead.
Another study had similar findings in that family was associated with less alcohol and tobacco use. Again, Columbia University has clearly done a lot of that. Well, we wanted to throw in some actual
Let's
data.
do a review. What
Right.
do you know so far? What are the benefits of family meals? 3 or more times per week. Last what?
Less academic failure, better grades.
Better grades.
All right, what else family meals relate to?
Less
Obesity, less obesity. Right, and both these are kind of obvious. Again, healthier meals at home. Grades, you're encouraging, all right, at home. Less, what else is going on? What else is happening? Gang membership. Because, again, gangs replace families. And family meals are what a lot of good bonding's occurring. And gangs take kids without functioning families because gangs become the family.
What else?
What else? Sexual
Sexual
activities. You know, lots of times sexual activities, early onset relates to not having a positive father figure for girls. And so a positive father figure that's a parent at meals relates to less sexual activity, later sexual behavior, later onset of sexual behavior.
Okay. Good work. You passed the test.
Yep. So who's doing CEUs? All right, we'll give them CEUs. Well, we wanted to show you some real data as examples. And again, we have data from, from various states. Gary, being he lives in Idaho, wanted to look at Idaho data. And the statistic is called an odds ratio. And you know, if you're not into statistics, if it's below 1, that means it's related to a lot less. Like a 0.54 is half the odds. Above 1 means more odds, so 2. Well, if you have 4 or more family meals per week, what are the odds, Gary, of you feeling hopeless or sad for 2 weeks during the last 12 months?
They dropped by 50%.
You know, that's sad and hopeless, you know, kind of depression. What about considering suicide in the past 12
Dropped
months?
by 50%.
Yeah, drops by half. Planned suicide in the last 12 months.
Dropped by 40%.
Yeah. Attempted suicide in the last 12 months.
Dropped by over 50%.
Hurt yourself, cutting, burning in the past 12 months.
Dropped by half.
Mental health kind of variables. You know, it really works. We also looked at victimization, and this was data we presented at the American Society of Criminology last November. And we were looking at victimization issues in family dinners. And if you had 4 more family dinners, you know, and these are, you know, you were, you know, if you had family dinners, you're more likely to wear a seatbelt. This is kind of in verse. You're more likely to wear a seatbelt. You were more likely to wear a bicycle helmet. You were less likely to be bullied at school or slapped by a boyfriend or girlfriend, less likely to date rape, less likely to commit a delinquent act, less likely to use alcohol. You know, family dinners related to, who would have thought related to wearing a seatbelt? I mean, who would have predicted that? Well, what's going on at family meals? We've kind of hinted at this quite a bit. First of all, there's monitoring. You know, one of the strongest predictors of preventing youth risk behavior is parental monitoring. And, you know, this can be beyond parents in the community. You know, there's a TV program in the United States called Cheers. Anyone ever heard or seen the TV program Cheers? All right, what is the characteristic of Cheers? You go to a place where what?
Everybody knows.
Everybody knows your name. All right, well, monitoring affects us all. You know, have you ever been and someone says, "What's your name, kid?" Okay, well, we've all kind of known that. Monitoring really is important to controlling bad behavior. So the family meal is a time for monitoring. You know, what's going on in your life? You know, what's happening at school? It's where we used to do sometimes my children's homework. They would have homework. After school, they would do their homework. At family dinners, they'd kind of bring questions up that they couldn't answer. So monitoring behavior. Emotional bonding occurs at family meals. You know, meals are associated with positive emotional interactions. Family meals in many cultures are pleasant experiences. We eat together. We share a meal together. In fact, eating together really assumes that there's some emotional bond. So we bond. We talk at meals, communication. In fact, Gary and I and Kiti have published a study in a journal called AIDS Care, in which we found that, you know, conversations between parents and children related to less sexual risk behavior and less alcohol and drug use. Communication occurs at meals. It's a time we may stop and sit down together. Role modeling. Our children see what we do and who we are. But why aren't we doing this? Why are family meals declining, Gary? What's going on?
People think they're busy. I don't think they all know the value of it. And life offers so many distractions today. It's tough. You know, there's the cell phone that rings during the family meal. There's the, you know, the headset the kids wear.
The teenagers come to family dinners with a headset? Yep.
Look, here's what you got to do. You got to set a basket in the kitchen, and all the electronic devices go in the basket. Then you got to leave a message on your phone that said, "We don't answer the phone during meals. Call us back in an hour," or something like that. Okay? And then turn off the television and eat. And do it with no distraction.
Because a family meal where the teenager's on the headphones and dad brought a newspaper and the other kids are texting are not a positive impact from family meals.
The television's going.
Television's going. You don't have the positive impact that we're talking about in the data. In fact, this analysis, and, you know, Gary led us into this, our group into this, and I have a group at Andrews working on this in various ways, and my daughter's in that research group, and she has a boy, 15, I gotta remember my grandchildren's age, I think it's 15, 12, and 9, or close to that, and their family dinners have changed because of these data. They actually have this basket in which there is no texting. You cannot come with headphones to dinner. You cannot bring a magazine to dinner. Dinner is without any electronic interruptions. So we'll see. We'll do a longitudinal study on my grandchildren, see how it turns out. But, you know, data affected my daughter's family interaction.
I bet they affect Danny's too, Danny and Sandra's.
Well, they're going to turn it off too, and they have family dinners and kids. But it's really important. This communication, this monitoring, this bonding, well, the role modeling is occurring, but it's not good role modeling, occurs best if you don't have these distractions. No TV, no electronics, no headphones, a basket they put in there, they're not at the dinner table.
This is a free prevention strategy. It didn't cost you a penny. It just takes planning. It's simple to understand. Anybody can do it. You can start it tonight. It's simple. It's very simple. And it's effective.
All right, the basket, all right, and again, my daughter uses this technique, and you can actually, boy, that's quite a few cell phones. Well, actually, no, they have about that many. That's a good point. Mom, dad, two, yeah, all right. So you may need a bigger basket, depending upon what you have.
By the way, a good idea also is to keep the cell phone out of the kid's bedroom.
Yeah.
You know, kids who miss 15 minutes of sleep are more likely to get bad grades. So actually, you need to keep all the electronics out of the kid's bedroom. No television, no computer. Beds are for sleeping. Bedrooms are for sleeping. And it's best, the American Academy of Pediatrics says 0 screen time electronically for kids below 2. 0. So let's get the electronics away from the kids and read to them and talk to them.
Well, if you're going to get suggestions and give advice as a physician, as a public health person, how can we all here do this? What do we do?
Well, let's do the 4 to 5 times per week. Make it an event. Plan it out.
Well, an event. In my daughter's family, my grandchildren have favorite meals. And so maybe you rotate the favorite meal through the children. So everyone, gets to have something they love, assuming it's not something destructive, but everyone gets to have something they love.
Make it an event. Make a family activity, include everyone in the preparation process. Tell your kids, you plan the meal for Thursday. What's it going to be? Maybe it'll be Spanish. Maybe it'll be
Breaded
Mexican,
deep fat
maybe
fried
it'll be-
cheese?
I don't know.
Probably not good.
I don't know. You can negotiate.
Yeah. If you eat 5 bunches of grapes, you get cheese? Okay.
I'm not going there.
All right. Make cooking a family activity, include everyone in the preparation process. Is a really good point. Because what that does, it gets children to eat healthy and to learn how to eat healthy and to feel the meal is a part of them. Yeah, that's it. All right. That's it. So you can tell when it says end.
I know.
All right. But look, we said this is stuff we're into right now. We're analyzing these kind of data, so they're hot on our mind. And we're just amazed at what these data relate to. Again, it's not a magic bullet. It's good sociology and psychology and public health. Because family meals are a tradition in almost all human cultures. We've lost the benefit of that with two-income families, with fast food, and with electronics. So we've destroyed what every culture's strength is, that family meal. We sit and break bread together. The symbol of the Last Supper is culturally core to every human culture. The supper, and Jesus said again, when his second coming, I will not break bread again until I break it with you in the new heaven, in the kingdom. So bread shared, meal shared are part of a spiritual heritage of Christianity. It is the holiest ritual in all of Christianity. So there's nothing new in what we're saying, but we've lost what this is. Two-income families, fast food, supersizing, electronics. What we're saying is that scientific data suggests that if we go back to those cultural traditions of meals together, of monitoring, bonding, communicating, and role modeling, we affect our children's grades, risk behaviors, and we set them off on a much better life path. Grades, less risk behaviors, better behavior, if we go back to what the Bible teaches about breaking bread together, to what all of our cultures say about the importance of sharing a meal together. Thank you.